joined PSSIU now almost 20 years ago, first of all at the University of Kent, where I was a research assistant, and then I moved across when a branch of the unit was opened here at the LSE, and I've been here ever since. PSSIU has grown fantastically. I think that's one of the biggest changes. We are now a very, very big family indeed. Just here at the LSE, there's almost 40 of us. I think a similar number in Kent and quite a few in Manchester. So just the size has increased very dramatically. I've covered quite a few areas of analysis. Generally speaking, I do work on the economics of health and social care systems, but more specifically, I've done evaluations of different types of services, like the individual budgets, the community care reforms in England, but also analysis more at the system level in terms of funding or the relationship between health and social care. There's been quite a few that have been very exciting in terms of their capacity to have an impact on policy. Perhaps if I had to underline one, it could be the funding, for example, work that we have been doing over a number of years, and that hopefully has helped government develop its thinking and policies in the area. We've been able to show a number of things that hopefully have had an impact. One is the extent to which some individuals in society are faced with catastrophic costs associated with social care and the need to do something in order to help people not, for example, having to sell their homes, but also in general the models that we've developed have been able to illustrate the distributional effects, the effects that different policies would have on different people in society with different needs and different income and wealth. I think, internationally speaking at least, the English government is quite good at responding to evidence, but in the odd occasion, I think what happens is that policy overrides any other consideration, and sometimes what might be an evaluation to look at whether something is a good idea ends up being an evaluation about how best to implement something that government has set their mind on. So in a couple of ways, I would highlight two. One is that there is an even growing tradition of evaluation. I think the quality of the evaluations and the demands for better evaluations from government are increasing. On the other hand, I think there's less freedom for academics to set the agenda in terms of the work that we do for government. I think that's more tightly controlled and responds more to sometimes short-term needs by government. I think if it was within my power, I would introduce a national care system, something that brings the social care system to the same sort of setup that the NHS has. Funding obviously then drives a lot of other things, but making people entitled to some state-supported and state-financed care. I think what is needed is to build the evidence so that we understand for a long period, so for 5-10 years, what the impact of different services is on the quality of life of individuals. So really understanding what the effect of different services is on different people with different needs and characteristics. In England, over the next 10 years, I would say funding must be the highest priority. The fact that over the last 3 to 4 years we've lost 200,000 people receiving state-supported care is a very significant fact, and I think just redressing that will be a very important priority. Obviously, it is difficult to predict what's going to happen to the system in hopefully what will be 40, 50 years before I need it. And I would hope that social care will become something, a greater policy priority. But on the basis of where it is going now, I would have to rate it at a 5. So not very positive, I'm afraid.